Hello students, let's begin our lecture on class 4 antiarrhythmic drugs, that is calcium channel blockers. Class 4 antiarrhythmic, which are calcium channel blockers. Now, calcium channel blocker are of two types. Dihydropyridines and non-dihydropyridines. Dihydropyridines are not used as they worsen arrhythmia, whereas non-dihydropyridines are used as class 4 antiarrhythmic drug. Example of dihydropyridines: amlodipine, nifedipine, nicardipine, clevidipine. So class 4 antiarrhythmic drugs, which are calcium channel blockers. Calcium channel blockers are of two types: dihydropyridines and non-dihydropyridines. Non-dihydropyridines are used as class 4 antiarrhythmic drug, whereas dihydropyridines, they are not used as antiarrhythmic drug because they worsen arrhythmia. Examples include amlodipine, nifedipine, nicardipine, and clevidipine. Dihydropyridines cause peripheral vasodilation. Vasodilation in case of dihydropyridines is more potent as compared to vasodilation seen in case of non-dihydropyridines. And due to this peripheral vasodilation, there is decrease in blood pressure. This decrease in blood pressure causes compensatory increase in sympathetic discharge. And that causes reflex tachycardia. So this reflex tachycardia causes heart rate to increase. Another important point regarding dihydropyridines. Dihydropyridines mainly block calcium channel on smooth muscle of blood vessel. So we have studied here dihydropyridines. They cause peripheral vasodilation, and this vasodilation is more potent as compared to vasodilation seen in case of non-dihydropyridines. So this peripheral vasodilation causes decrease in blood pressure, and that causes compensatory increase in sympathetic discharge. That results in reflex tachycardia, and due to reflex tachycardia, heart rate increases. Another important point regarding dihydropyridines. Dihydropyridines mainly block calcium channel on smooth muscle of blood vessel. So they are more selective for smooth muscle of blood vessel. So they are mainly used in treatment of hypertension. Non-dihydropyridines are class 4 antiarrhythmic. Examples of non-dihydropyridines: verapamil, diltiazem, verapamil and diltiazem are selective for cell of SA node and cell of AV node. Verapamil and diltiazem are also selective for atrial cell and ventricular cell. So non-dihydropyridines, they are class 4 antiarrhythmic drug. Examples are verapamil, diltiazem. They are selective for cell of SA node, cell of AV node, and they are also selective for atrial cell and ventricular cell. So this is the figure of cell of SA node or cell of AV node. There are L-type calcium channels on the surface, on the cell membrane of cell of SA node or cell of AV node, through which calcium influx is happening. These L-type calcium channel are inhibited by non-dihydropyridine, for example, verapamil or diltiazem. So inhibition of L-type calcium channel result in decreased calcium influx. In phase 4. Decreased calcium influx in phase 4. That will cause slower SA node potential. And the slower SA node potential will result in decreased impulse generation from SA node. Decreased impulse generation from SA node, that will result in decrease in heart rate. One important point to be noted. Reflex sympathetic stimulation due to vasodilation that is happening due to non-dihydropyridines like verapamil or diltiazem. This reflex sympathetic stimulation partly contracts the direct bradycardia producing action of verapamil or diltiazem. So, due to decreased impulse generation from SA node, there is decrease in heart rate, and this decrease in heart rate is partly contracted by reflex sympathetic stimulation, which is happening due to vasodilatation produced by non-dihydropyridines. So non-dihydropyridines like verapamil or diltiazem inhibit the L-type calcium channel, and these drugs also delay the recovery from block. They delay the recovery from block of L-type calcium channel. So due to the inhibition of L-type calcium channel by non-dihydropyridines, there will be decreased calcium influx in phase 4. That will result in slower SA node potential, and slower SA node potential will result in decreased impulse generation from SA node. Decreased impulse generation from SA node. So slower SA node potential will result in decreased impulse generation from SA node, and that will result in decrease in heart rate. And one important point is that this decrease in heart rate is partly counteracted by reflex sympathetic stimulation due to vasodilatation by non-dihydropyridines like verapamil and diltiazem. This graph shows the phase of SN node potential. There is the normal SN node potential with phase 4, phase 0 and phase 3. We can see the calcium influx which is happening in phase 4 and also happening in phase 0. So this is normal SN node potential. Now we'll study the effect of non-dihydropyridines, that is verapamil or diltiazem, action on SN node potential. So what will happen? I am showing in red color. There is no decrease in slope of phase 4 in case of non-dihydropyridines. But in case of beta blocker, there was decrease in slope of phase 4, which we have already discussed in previous lecture. After that, there is slowing of SN node potential as shown in the graph. So non-dihydropyridine action on SN node potential, no decrease in slope of phase 4, and there will be slowing of SN node potential. Non-dihydropyridines block L-type calcium channel on cell of AV node, so there will be decrease in calcium influx in phase 4 of AV node potential, and that will decrease conduction through AV node. That will cause slow transmission of impulse from atria to ventricle. transmit slowly from atria to ventricle, and that will result in longer PR interval on ECG. So non-dihydropyridines block L-type calcium channel on cell of AV node. Non-dihydropyridines also delay the recovery from block. Non-dihydropyridines also delay recovery from block. So what will happen? It will also assist in decrease of conduction through AV node. So impulse will transmit slowly from atria to ventricle, and that will result in longer PI interval. So non-dihydropyridines block L-type calcium channel on cell of AV node, so they will decrease calcium influx in phase 4. So decreased conduction through AV node. This decreased conduction is also happening due to delay recovery from block of calcium channel due to non-dihydropyridines. So impulse will transmit slowly from atria to ventricle, and that will result in longer PR interval on ECG. PR is the time between onset of atrial depolarization and onset of ventricular depolarization. So longer PR interval on ECG, and PR interval is the time between onset of atrial depolarization and onset of ventricular depolarization. In the next lecture, we will study about non-dihydropyridines action on atrial cell and ventricular cell. Thank you.